Cancer clinical trials, practical tips to improve Asian American participation. This course is presented by the Stanford Cancer Institute Community Partnership Program and Clinical Trials OSCE, in collaboration with the Asian American Cancers Network for Cancer Awareness, Research and Training by Asian Alliance for Health. Course online. Module 1, Cancer Clinical Trials Basic. Module 2, Cultural Immunity in Cancer Clinical Trials Education and Referral among Asian Americans. Module 3, Resource and Practical Tips for Increasing Asian American Participation in Cancer Clinical Trials.
Sometime in the future, people may look back on today as the golden age in cancer research.
In the old days, we used cytotoxic drugs that kind of worked across the board and just sort of wiped out rapidly growing cells. The newer advances in molecular biology and biochemistry is that they're finding out what are the growth pathways that drive various cancers.
As cancer treatment moves towards individual drug therapy, studies are honing in on these cancer pathways and trying to find ways to shut them down. That's where drug trials come into play.
That's what basically produces the advances, and that's also a way in which we give the latest cutting-edge therapies to our patients.
Clinical trials come in 4 phases. The first involves patients who have exhausted their options and looks at the safety of a drug. The final phase generally comes after FDA approval. At any given time, people in Southwest Florida are taking part. Each drug has different qualifying characteristics that determine.
So continue. Courses overview. Radical and ethnically diverse and critical to apply the result in clinical trials to all population. Asian Americans, like another ethnic groups, have low levels to participation in cancer clinical trials. Increase the Asian American participation in cancer clinical trials will be facilitated by increase the learners' knowledge about the mechanics of trial, the improved cultural immunity, and the practical clinical approach to engage the patients to participate. So here another video.
Clinical trials test promising new therapies with people in various stages of cancer, from first diagnosis to advanced disease. Patients may learn about clinical trials from their doctor or on their own, through libraries, information lines, and the internet.
A clinical trial is a test to see if a drug or treatment will be effective in treating human disease. 100% of the people who take a medicine or treatment for a disease are standing on the shoulders of someone who participated in a clinical trial.
Clinical trials are an essential part of proving that any new medicine or treatment works for the group it's intended to help. Many of today's accepted uses of medicines came through clinical trials. In the 1970s, for instance, doctors and nurses began to think that aspirin might save the lives of people who came to the hospital having a heart attack. Because thousands of patients agreed to participate in the clinical trial of aspirin more than 30 years ago, doctors today routinely give aspirin to hundreds of thousands of patients every year.
So continue. Course overview. This course was developed to educate healthcare providers and allied health professionals about cancer clinical trials, cultural immunity, and publicly available resources to improve outcomes in Asian American participation in cancer clinical trials. Learning objective. Develop strategies to determine appropriate a patient for clinical trials. Apply cultural immunity skills to effectively communicate with Asian American patients about the cancer clinical trials. Identify at least 5 ways that will reinforce change in participation to incorporate clinical trials education and referral among Asian American patients and apply in the practical. Recognize how to access at least 5 cancer clinical trial resources and use them in education and referral. So we're gonna see in the last video.
대부분의 미국인들처럼 이 아이들도 행복하게 오랫동안 살 것입니다. 대부분의 미국인들이 심장질환으로 사망하는 반면 이 아이들은 그러지 않을 것입니다. 왜냐하면 아시안계 미국인들의 사망 첫째 원인은 암이기 때문입니다.
오늘날 우리는 암에 대하여 많이 알고 있습니다. 정상적인 세포들은 일반적으로 자라고 분해되고 그리고는 죽습니다. 그러나 어떤 경우는 그렇지 않습니다.
어떤 경우 세포들은 통제가 되지 않을 정도로 계속 자라기만 합니다. 그 세포들이 하나의 종양을 이루고 신체 다른 부분을 공격합니다. 그것이 암입니다.
첫째로 암은 아주 다양한 종류의 질병입니다. 암은 사람들마다 각각 다르게 공격합니다. 그러므로 우리는 암의 각 종류에 맞는 가장 적절한 치료법을 찾아내도록 연구해야 합니다. 그러한 타입의 연구를 임상실험이라고 부릅니다.
임상실험 참여 혜택은 임상실험에 참여하는 환자 자신에게뿐 아니라
So, thank you.